Okay, first I'm gonna check the medical record for the physician's order for irrigation and the correct sterile solution to be used. Then I'm going to assess Mr. Seymour's pain level and administer pain medication 30 minutes prior to the procedure. I'm going to warm the irrigation fluid or the sterile fluid in water to make sure it's room temperature. And now I'm going to see Mr. Seymour. Hi, Mr. Seymour. My name is Jenny. I'm going to be your nurse today. I am going to be assessing your wound and irrigating it per the physician's orders. And I am going to perform hand hygiene. I'm going to raise the bed to working height, and I'm going to lower the rail so I can work a little bit easier. I'm just only going to expose Mr. Seymour's wound only and get him in a comfortable position. And I did already ask him if he's having any pain. And I am going to grab a waterproof pad. I'm going to place it on this side of him. I'm also going to put a pillow on the other side so that he's in a comfortable position, and that way the wound can drain appropriately if it need be. I'm going to grab an emesis basin and a Q-tip, and I'm going to grab my measuring tape. The correct one here. I am going to untie these straps, and I did perform hand hygiene. Okay, before I remove everything, I'm going to grab my bag for soiled dressing and put it right here. And I performed hand hygiene. I am going to grab gloves and apply those, and I would put on any other PPE that I deemed appropriate just in case there was splashing. At any point in time, Mr. Seymour, let me know if you're having any pain or discomfort. At first, I'm going to move the ABD pad and note that there is no drainage on this pad. I'm going to remove a 4x4. I notice that there is slight serous drainage. I'm going to move the packing wound. And I'm going to note that there is some serous drainage on the 4x4 as well on this one. Okay, now I'm going to note that the wound has some undermining and there is tunneling at 1 o'clock. And I'm going to take my Q-tip and say that there's about a centimeter of tunnel, or a centimeter deep at 1 o'clock, and I would say about a centimeter deep at 9 o'clock. There is some serous drainage in the wound. I'm going to get rid of my Q-tip there. And I would note that the wound itself is 5 by 6. Okay, so now I'm going to remove my gloves and perform some hand hygiene. Okay, take these off, perform some hand hygiene, and I'm going to document my findings. I am going to document that there was no drainage on the ABD pad. There was some drainage, serous drainage on the 4x4, and there was serous drainage on the packing. The wound has some undermining, and the tissue inside did have some granular tissue that I didn't see, and some serous drainage in the tissue. There was a centimeter depth of tunneling in the 1 o'clock and 9 o'clock, and I do want to note that I didn't verbalize while I was assessing, but there's no odor. Okay, so now I'm going to perform some hand hygiene, and I'm going to set up my sterile field. Okay, I'm going to keep my hips facing forward my field at all times. I'm just going to get this ready, making sure that I'm not reaching over. I'm going to grab my irrigation fluid. I'm going to pour it in my bowl. This is a new bottle, and I'm holding it labeled to palm. Pouring my water in, and I'm going to put that back into the room temp water. Now I'm going to grab my supplies. I'll grab my syringe, which I'm just going to make sure that doesn't fall within the 1-inch limits. I'm going to put that in the trash, and that would have fell right here. And I'm going to grab my ABD pad, I'm gonna make sure that this falls within the appropriate limits too. I'm gonna put this in the trash too. And that would have fell on the floor. And now I'm going to apply my sterile gloves, keeping my hips facing my sterile field. I'm gonna apply for my dominant hand first. Okay, I'm gonna grab my dominant hand, making sure that I am keeping my gloves sterile. And I'm going to grab my non-dominant. And adjusting this, keeping them sterile. Okay. Sterile to sterile. Okay, now I'm going to be facing my sterile field, and the first thing I'm going to do is grab my syringe, and I'm going to draw up 35 milliliters of sterile solution. I'm going to walk over to the wound, and I'm going to drain from superior to inferior until it drains clear. Okay, it has drained clear. I'm going to throw that, or that would have fallen on the floor. And the first thing I'm going to do is grab a 4x4, and I'm going to pat just the outside of the wound and not making sure I don't touch the inside and keeping my hips forward. And I'm going to do this. Noting again, I'm not touching the inside of the wound. This is garbage, not reaching. And now I'm going to grab a gauze and dip it in my sterile solution. I'm going to unfold it. And we are going to make sure that we're going to drain the excess moisture. And I'm going to begin packing the wound with my sterile Q-tip. And for the sake of this competency, this is a dry gauze, but I would note that I would not be touching the outside of the wound while packing it. I'm going to make sure I pack in to all the tunneling surfaces. And again, it's not touching the outside of the skin. Okay, that wound is packed. I'm going to dispose my Q-tip. I'm going to grab a 4x4, a sterile 4x4. I'm going to place it over the wound. And now I'm going to place a sterile ABD pad with my blue line facing up. I'm going to place it over like this. And now I am going to just face my patient, ask him, Mr. Seymour, did you have any pain during that? And I'm going to tie the straps. So the wound, I'm no longer sterile. I can tie these shut because our wound is packed. Now I'm going to dispose of my gloves. I'm going to grab the pad out here from him. We're going to get Mr. Seymour in a comfortable position. Remove all of my garbage. This would all go in the trash. Okay, I'm going to adjust Mr. Seymour back in a comfortable position. Mr. Seymour, did you have any pain at all during that dressing change? He reports no. Wonderful. We're going to cover him back up. I'm going to raise the bed railing, and I'm going to give him a call light. We'll move this. We're going to lower the bed to a safe position. I did say he has a call light. I performed hand hygiene, of course. And I'm going to document my findings, or I'm going to document what I just did. I am going to document that we irrigated the wound with a 35 milliliter sterile solution ordered by the physician. We used a sterile 4x4 to pack the wound, another 4x4 to cover the wound, and a sterile ABD pad dressing over that. And then we tied it with the Montgomery straps. Mr. Seymour said there was no pain, and we did note that there was no red bleeding, no evisceration or histence. I'm sorry that I pronounced that wrong, but there was no note of that either. I am going to provide privacy, the patient is safe, call late, perform hand hygiene. Thank you.